G'day everyone, this is Health Highlights. I'm Simon Lashley, hanging around here. Health Highlights is a show about health professionals, and the people and the stories behind the names that we often hear about, but we seldom get to meet. And today, I'm here at How's That, at Elite Performance, which is owned by Paul Henderson. Hey Paul, how you going?
G'day mate, how you going? Nice to be with you.
Paul is a practitioner in this thing which I'm hanging from right now called red cord, and we're going to discuss what red cord is all about and the effectiveness it has for treatment. So stay tuned. Everyone, I'm the right way up now, which is always much better to do an interview. So thanks for joining us. Paul, thank you for joining us. It's great to be here.
Thank you.
So Paul is a ART and a red cord specialist, and as you can see, this contraption here is what we call a red cord. So Paul, can you explain to us what actually is red cord?
Well, red cord was basically developed back in 1991. It was actually from Norway.
Yep.
And basically a Norwegian sailor, was a carpenter as well, and he had some pain in his back, and as a young fella, he basically had gymnastics background, and he went to get some traction on his back, and he found that the actual the traction really didn't help his back that much. But he went back to his shed, I suppose you could say, and put some sails under his back, and put some cleats and some slings and some ropes, and he started to exercise, and he found that really helped his back. So then back in it was 1999, they developed SET, which is sling exercise therapy, and then basically from there the exercises progressed. Then in 2003 it basically then started to develop more of a science called neurac. 2004 they started to develop their first introductory courses, and then in 2007 basically then they formed what they call neurac to all physios and exercise scientists, and it just developed into what it is today. So basically we have what we call a workstation. Yep. And the workstation comprises of three trainers, and basically with hooks. Here we have Ashley. Ashley's
doing a great job, Ashley.
Thank you.
Ashley's hung up in a position called a supine pelvic lift, or we do a supine pelvic bridge. We also have another sling that's underneath her knee, and basically then we get her to go through a series of different tests. And the whole aim is to basically find out where her compensation patterns are. Mm-hmm. Primarily we're looking at where weak links are in her body. We're looking at the whole body and what we call a closed kinetic chain.
So when you have a client come in, I mean, we all see manual therapists and physios and osteos and massage therapists. What particularly are you looking for in a client that would indicate, well, you know what, red cord is actually going to be really helpful in your condition? Is there particular things that you're looking for more so?
Yeah, well, I'm looking at basically how the body's connecting in terms of, you know, she might have a shoulder problem, but actually it could be coming from a glute. We've seen that in numerous accounts where I actually get patients where they walk out with going, well, yeah, I had a shoulder problem, but I didn't know that I was unstable in my hip, or you know, my deep, sort of stabilizers were not switching on. Even for the neck, it's amazing for headaches and neck problems and all sorts of problems there as well.
So, okay, so we come in and we see you,
yep.
And say we've got a neck problem, so let's say Ashley's coming with a neck problem.
Yep.
How, can you just show us, as Ashley is lining, how does it work, how does the treatment work in terms of getting some relief and getting some, I suppose, structural change? Can you just demonstrate for us?
Well, even if it's neck, I would still go through this first test, because we can sort of see, we're looking at the whole chain of, you know, even all the myofascial chains running through the body.
So specifically, what are you looking for here?
So what I'll do is I'll just go around, and as I said, you've got a sling here, and basically her legs, it's directly underneath her knee, so her arms will be by her side. So put your arms by your side, Ash. So what I want to do is I want to get this leg to this leg, and all the power and everything will be generated for under this sling. This sling under here is just going to basically help lift her up. Now I can also offload her, and I can also make it easier, or I can make it harder. Not at any time we want the patient to ever feel pain, and we don't want to send those wrong receptors.
And so what actually are you treating in this particular?
Well, this particular one I'd be looking at sort of like a lot of hip.
Yes.
Also, it'll help with her back, and it'll help with a lot of her core stability, pelvic floor.
So you're really having to engage some of these
Absolutely.
muscles to actually be in this sling position.
And sometimes too, we can see when the patient comes up, they might be rotating through their hip, their pelvis might drop down, their shoulders might be slightly elevated, and we want to see a nice line between the scapulas, between the actual sacrum and the hip, and the alignment of the ankles as well. So what I'll get her to do is hold that leg there for me, Ash. Now I want you to push down and lift your hips up for me, and then push from here. That's it. Now hold that there for me. Now we can automatically see that she's dropping that shoulder down, and that hip automatically wants to come down.
Yep.
So my job as a therapist is to correct that.
Yep.
And then see her shoulder. I need to then push this shoulder back so I can correct this alignment here.
Yep. Yep.
And you can automatically see that her knee's dropping down as well. So she's fatiguing pretty quick. Come down for me. So they're just little key things that we can see to basically like identify those patterns in the body. So my job is to then fix those weak links.
Yep.
And I want to reconnect the brain to then have those muscles or those muscle counter-receptors to start firing again.
And so that was my question. So the science behind this is all about neurological feedback.
Absolutely.
And actually getting the body's ability to actually coordinate its movement and
Absolutely.
actually strengthen up. So is that really the science behind? So can you?
Absolutely. Well, the science is there to basically back up. There's lots of studies from Norway, and it's also implemented into 35 countries worldwide.
Yep.
Some of the Asian countries such as Korea, Japan, China, it's massive. It's probably even bigger than Norway. And yeah, so definitely what happens is the whole idea is that we want to have the brain to connect to the muscles.
Okay.
It's not the other way around. So red cord is it's low tech, high knowledge.
Yep.
And red cord, we follow a system compared to other sort of training methods or rehab methods. We have a set system that we follow, and we do what we call a weak link test.
Awesome. So and that's what you're looking for, the weak link.
Absolutely.
So can we maybe get Ashley in another position
Sure.
to see another position? Okay, so now we've got Ashley in a different position. Can you explain what this position is and what we're looking for here?
Okay, so this position here is what we call a sideline hip abduction. We're looking at the whole posterior chain. So basically my whole, the look that I'm looking for is from the head to the foot. And basically we're really trying to isolate the gluteus medius muscle, but we're still looking at a lot of the stabilizers muscles as well that go around this whole cylinder of our body as well. So what we're going to get her to do is we're going to get her top leg to come up for me, and then basically we've got a nice straight line, so I need to just push her, come back just a little bit for me, that's it. So I've got a nice straight line between her neck down to her ankle, and what she's going to do is I'm going to get you to push down and lift your hip up for me, and bridge here, that's the way. So we want this up, that's it, and we want her to be nice and straight through here. Stay there and push here more for me, that's great, and hold that there for me. So we're looking at a nice line from there to there, isolating the glute and really getting that switched on. Relax and come down for me.
So what sort of athletes, people, like you're wanting to see mums, athletes, what sort of people are going to benefit from having a red cord session or two?
Anyone from your elite sportsman to basically your everyday factory worker to your everyday weekend warrior, to anyone that's got pain or discomfort or has something that's posturally just not quite right, and that's why red cord can really help sort a lot of those underlying issues out as well, which is great.
Obviously it will be complementary to say physio or other sort of therapy. How is it complementary to that? So what are you doing that maybe is a little bit different that actually people can benefit from?
I think it's a little different because we're training in an unstable environment where I think traditionally we have other exercises that physios use. They're still great, but I just find this gets to the cause of the problem a little bit quicker because those ropes really give me, cues me in terms of finding out where those weak links are coming from. And people can really find that, hey, yeah, that was really unstable. I didn't really understand where that problem was coming from, and they do now. So that's why I think it's quite fun, it's safe. We never want people to train in pain, and it basically gets to the root of the problem very quickly.
Wonderful. So now, many of you may actually recognise Paul, or at least his name. So we are standing in a little bit of a famous person. I remember as a kid watching him in the Commonwealth Games and World Championships. So Paul, you're not, the whole sporting area is not unknown to you because you are a great athlete in your time. Can you tell the people a little bit about your history?
Yep, so basically as a young kid I had the ability obviously to run fast. I competed in obviously 3 World Championships, Commonwealth Games in '94 and the '96 Olympic Games. I have a world silver medal from the '95 World Championships, where we still have that Australian record to this day. I think it's only one of a very few select group of people that have a medal of that standard.
So can you tell? So that was a relay.
That was a relay.
Was that the highlight of your sporting career, to win a silver medal at the World Championships?
Absolutely, and also I was one of Australia's top 100-metre sprinters. So also I competed as an individual sprinter as well in the '95 World Championships, as well as the Olympics in '96 as well.
So who was part of that team? Because many of you will remember the names and also the time.
Well, I ran the first leg, so I ran first. The second athlete was a guy called Tim Jackson. The third runner was a guy called Steve Brimacombe, and on to our last athlete called Damien Marsh. So they were our crew, and that relay team is the best so far in Australian history.
Wow, that's amazing. Well, congratulations to you.
Thanks, mate.
And congratulations to what you're doing here. I know that it's helping a lot of people. So thank you everybody for joining us. Thank you, Paul, so much for giving up some of your valuable time.
No problem.
If you want to find out any more about Redcord or what Paul is doing here, you can look on his website, which will be on the screen right now, or you can give him a call on the phone number on the screen as well. Look, thank you everybody for joining us. Thank you, Ashley, for hanging around for us. We really appreciate it. Remember, at 12:30 Wednesday next week, we're going to have an incredible interview for you. So stay tuned then. Thank you, everyone. Remember, healing is a gift, health a responsibility. Have a fantastic weekend. See ya.
Thank you.